for Eisenhower. I'm an emergency physician at Scotland Healthcare System. When patients don't have the right healthcare insurance, they end up here in my emergency room. The current version of the Senate healthcare bill will drive more patients to the emergency department, thus driving up healthcare costs. Senators Burr and Tillis, please help us keep healthcare costs down by making sure people get the right care at the right place at the right time. Thank you.
Go for it. Hi, I'm Tom Seavers, the CEO at Dosher Hospital in Southport, North Carolina. Healthcare is so important, obviously, to our community, to our country, to our state. But for our hospital, it really is critical. There's only 21 critical access hospitals in North Carolina. Dosher is the only independent critical access hospital that's left. Every other hospital has been absorbed or owned or managed by another large system. What the decisions that you make have a profound impact on all of us. Please continue to listen to us. Senators Tillis and Burr, you're very important to making healthcare a reality for us, and I hope we can continue to work together. Thank you.
Senators Burr and Tillis, my name is Sid Fletcher, and I'm the Senior Vice President of Medical Affairs for Novant Health's Greater Charlotte market in Charlotte, North Carolina. I wanted to reach out to you today on behalf of patients and those of us who are very concerned about the Affordable Care Act in the state of North Carolina. Certainly, frontline providers have shared with me, and I have been a frontline provider in the past. And I would just tell you that current state, the Affordable Care Act is not working for our citizens, and we encourage you to work with us to figure out how we can remedy the law as it currently stands today.
I'm Vanessa Early with Onslow Memorial Hospital. I serve as a trustee. We're about community. Community hospitals is the network for healthcare for our citizens, whether they're the aging population, mothers that are having babies for the first time. It's so important to us that as a hospital, we have what we need to further healthcare in the future. Senator Burr and Tillis, please remember to work with us.
Senators Burr and Tillis, I'm Paula Vincent. I'm the president of Novant Health Presbyterian Medical Center and Charlotte Orthopedic Hospital in Charlotte, North Carolina. On behalf of our patients and our providers, I would ask you to work with us to improve the Affordable Care Act. It is not working. It needs to be fixed. An example is without the Affordable Care Act being fixed, we have patients coming to the emergency room for episodic care and more expensive care. Senators Burr and Tillis, we are here, ready, willing, and able to work with you to ensure that all citizens in this community receive access and affordable care. Thank you very much.
Senators Burr and Tillis. I'm Dr. Andrew Herrmann, Chief Medical Officer for Levine Children's Hospital in Charlotte and Jeff Gordon Children's Hospital in Concord, North Carolina. On behalf of patient and frontline providers, I ask you to work with us to protect our patients' access to essential health services. The Affordable Health Care Act is not working for all patients and needs to be fixed. North Carolina needs a plan that will ensure access to coverage that our patients and their families can afford to use. Please do not repeal without a plan to replace to protect our patients.
Senators Burr and Tillis, I'm Chantal Howard, and I am the Vice President of Nursing at WakeMed Health and Hospitals in Raleigh. On behalf of patient and frontline providers, I ask you to work with us to improve the Affordable Care Act. The Affordable Care Act is not working for all patients, and it needs to be fixed. North Carolina needs a plan that will ensure access to coverage that citizens can afford to use. Please do not repeal without a plan to replace. When people don't have insurance coverage, they are more likely to come to the hospital emergency department for episodic, expensive care. Senators Burr and Tillis, we are ready to work with you to make the best plan for the people of North Carolina.